appreciate the nature of behavior therapy, you must understand the model on which it is based. This lecture describes the general model of human behavior that forms the basis of behavior therapy. How do we define who a person is? What makes a person unique? What makes you unique? Well, according to the behavioral model, each of us is defined by our behaviors. In other words, by what we do. We are what we do. First, let us review overt and covert behaviors. There are two broad categories of behaviors, overt and covert. Overt behaviors are actions that other people can directly see or hear. In a sense, they are public behaviors. Examples include eating, walking, talking, kissing, driving a car, writing a sentence, cooking, laughing, and singing. Covert behaviors are private behaviors, things we do that others cannot directly observe. However, we usually are aware of them when we ourselves are engaged in them. There are three categories of covert behaviors. Cognitions include thinking, expecting, attribution, and imagination. Emotions is the second, and basically that is our feelings. And physiological responses such as muscle tension, heart rate, blood pressure, and respiratory rate. Overt behaviors like cognitions, emotions, and physiological responses contribute to four modes of behaviors that are assessed and treated in behavior therapy. Covert behaviors are no less important than overt behaviors. Assessing overt behaviors is relatively straightforward because they are directly observable. The covert behaviors of others are inferred from their overt behaviors. The other way we learn about someone's covert behaviors is by observing what the person does and inferring from their overt actions what is going on inside the person.